Every time I walk up in the spot,
I also wanted to read you 12 alternatives to vaginal exams, which vaginal exams are also called pelvic exams, by the way. Okay, so another way they can measure you or monitor you without having to use too many pelvic or vaginal exams, and the reason I'm mentioning that is because if you look it up, which is also in this book as well, it can actually increase your levels of bacteria in your body and can increase the risk of the baby getting an infection if you have multiple vaginal exams. So just so you know. So 12 alternatives to vaginal exams or pelvic exams. Changes in contractions. Contractions 2 to 3 minutes apart usually correspond to active labor and dilation beyond about 4 centimeters. Number 2, the height of the belly, the top. These are things that they can measure instead of doing pelvic exams. They can measure the height of the belly. I'm just going to go through them because I think it's going to be too much to explain every single one of them, and I don't want to take up too much time. The height of the belly. Number 3, bloody show. Number 4, bottom line. Number 5, the descent of the baby. Number 6, the baby's heartbeat. Number 7, bag of waters breaking. Number 8, ultrasound. Number 9, rectal pressure. Number 10, involuntarily having a bowel movement. Number 11, opening of the back. And number 12, seeing the head. I'm going to try to put little blurbs in the bottom to explain what those were about. Also, gotta go soon. Okay, so also before, if you are planning to use Pitocin in your labor, this book does also have a good it has a good chapter on how to have a great Pitocin experience, so you might want to check that out as well. Let's see, I know there was something else I wanted to read. Okay, I'm gonna read this. This is the reasons why people may opt out of vaginal exams, and you are allowed to do that. So while bad infections are very rare, they can cause serious harm to babies. 40 years ago, the search for a way to further reduce their incidence was the logic behind this time limit. The longer period of time with ruptured membranes is also associated with more infections. However, more current research shows that the use of vaginal exams is a primary factor that raises the risk of infection. The passing of time has not yet been shown to be a cause by itself. So if they tell you that your labor is taking too long and it can increase the risk of infection, yes, but the use of vaginal exams increases that risk by a tenfold. So that's not the only thing that's going to lead to an infection. Actually, having multiple vaginal exams after your water breaks or while you're in labor is the reason why a lot of people have infections. Starting with the very first vaginal exam, the chance of infection rises with every exam. Let's see. I wonder if I should read that part too. Okay, in the early 1900s, a main cause of mothers dying in childbirth was contracting infections from doctors doing vaginal exams without washing their hands, because it wasn't understood that this transmitted germs. Infections were known as childbed fever, and the resulting death rate became an epidemic in some European and American hospitals. The practice of hand washing and the development of antibiotics were the greatest contributions medical doctors made to reducing deaths in childbirth, which they had also unknowingly which they had also unknowingly often been the cause. Today, providers strictly follow a sterile technique in which, when conducting vaginal exams, which involves the use of a glove that has been completely covered in a protective seal. This reduces the chance of delivering germs from the room into the woman's vagina. But still, exams push bacteria that are already in the vagina upward and deposit them right onto the cervix with the provider's fingers. Sorry, my words are all over the place. Once the bag of waters has broken, the uterus is no longer protected, and the mother and baby can become infected. However, without a way for bacteria to travel upward, the flow of amniotic fluid down and out of the woman's body continues to protect them from infection. Okay, the last thing I'm going to say is infections of the uterus can be caused by a wide variety of bacteria. The most common group is group B strep. So that's when you have that GBS test. That's what that's testing for, the amount of bacteria. that's in your vagina. Many women carry the bacteria in their vaginas, and the presence of GBS can come and go throughout pregnancy. Caregivers now test pregnant women for GBS close to the end of their pregnancy to determine whether it's likely to be present at birth. If GBS is present, they give antibiotics in labor, which reduces transmission of the bacteria to the baby. However, even the presence of GBS is a much lower risk for having multiple vaginal exams. It's a much lower risk factor than having multiple vaginal exams in labor. So basically what that was saying is that even though there may be this GBS type of bacteria, that is not gonna, the risk that having a lot of vaginal exams carries is higher than the actual infection bacteria itself. So it's definitely worth it to look into how to talk to your doctors or midwives about how to have less vaginal exams during your labor, just for you and baby safety. And it's also just good for you to know what your options are. And I had no idea that these exams could be declined, or you can opt for less of them. So I just thought that was something that everybody could benefit from. Okay, here's a little fun story that I forgot to add in the video. I'm always forgetting things. Anyway, so last night, it's not a fun story actually, it's kind of a sad story, but yesterday when I was making food, I was just making macaroni and cheese, and I just all of a sudden got really, really dizzy. Like, I couldn't even stand up anymore. I was leaning over the fridge, and it felt like what was happening to me at work before I had to quit, and that really sucks because I thought I was gonna, my cat just fell off the table. So yeah, I got really, really dizzy, and I had to sit down, and I was like sitting for almost maybe 2 hours. I couldn't get up anymore, and it was just really hard for me to move around yesterday. So I don't know if that's normal. I'm pretty sure it is. Pretty sure dizziness is normal during pregnancy. But yeah, so just a little story for my 25th week. Fell over. Had to sit down for a while. Hi, so I'm gonna do a belly measurement, and this is actually kind of a surprise to me because I haven't measured my belly yet. But last week, the one that I missed was 35 inches when I found the measuring tape that the kitty so smartly kidnapped from me. So this is my 25th week belly measurement. Okay. Oh, here's what it looks like from the front and from the side. I hope you can see it and the sun's not too bright, because, yeah. Okay, so, let's see here. Okay. So the measurement comes in at about 35.5 inches. So 35.5 inches for 25 weeks then. Okay, so I'll see you in my 26 week video. Bye.